Today's car chat and school pickup is all about perineal tearing. I want to talk about things that I did with my first birth to avoid any sort of perineal tearing. So for those who don't know, you are more likely to tear with your first vaginal delivery. Around like 80 to 90% of first-time vaginal deliveries will experience some form of tearing. This does not mean that it is a severe tear, like a 3rd or 4th degree tear where you connect hole to hole, if you know what I mean. But like a 1 degree or 2 degree tear, those are super common, especially with your first vaginal delivery. And honestly, the recovery can be really smooth so long as you're following the guidance of a pelvic floor physical therapist. But as a first-time mom, first vaginal delivery, I was able to avoid perineal tearing. And I had an epidural and delivered in a hospital. And I know there's a lot of misconceptions that you cannot avoid tearing or that you're going to have a more traumatic labor if you have an epidural or if you deliver in a hospital. So I'm a pelvic floor physical therapist. I chose an epidural because towards the end of my labor, I could just feel myself tensing up my pelvic floor with every contraction. I was around 8 centimeters, and I knew that it was more important for me to be able to relax my pelvic floor, and I couldn't do that anymore. And so that's when I opted for my epidural. So here are some things that I did to avoid perineal tearing. Number one is I started labor prep well before 34 weeks of pregnancy. I started preparing my pelvic floor for birth as soon as I found out I was pregnant. And the ways that I did this involved learning how to lengthen my pelvic floor. Now, obviously, I already knew how to do that because I'm a pelvic floor physical therapist, but I practiced it more often. Down training, as so we call it in pelvic floor world, of your pelvic floor to release tension, because your pelvic floor needs to be able to spread and lengthen and get out of the way in order to deliver your baby. So that number one is I practice diaphragmatic breathing, focusing on lengthening my pelvic floor pretty much every single day as soon as I found out I was pregnant. And honestly, it helped with a lot of pain relief as well, because we tend to get really tense during pregnancy. The second thing that I did is I did perform perineal massage starting around 33 weeks of pregnancy. Now, this practice is debated a little bit in the pelvic floor world. Some are totally for it, some are say it doesn't work. There is some good evidence to show that it can help to reduce grades 3 and 4 tears for the first time deliveries, for vaginal deliveries. If you're a second time mom having a second vaginal delivery, then the evidence is a lot weaker, and it's a lot weaker for reducing first and second degree tearing. But there is some good evidence to support reducing 3rd degree and 4th degree tearing. So number one, pelvic floor lengthening. Number two, I did work on perineal massage. Now, however, I also want to know, if you're performing perineal massage and it's causing you pain and anxiety, it is not worth it. Forget about it. There are other things that you can do. I never want you to try and push through something just because you think you're supposed to, because honestly, then you could develop negative associations with any sort of pressure at your perineum, and that wouldn't be good for birth either. The third thing that I did is I didn't deliver flat on my back. Now, I was on my back, like it wasn't on my side or all fours. I had tried pushing on my side and it just felt super uncomfortable at the time. And so I had the nurses elevate the head of my bed. I didn't want stirrups. And I also had them put a towel roll underneath of my butt on one side, or sorry, not on one side, like in a U shape, kind of like this, like a U, and so my sacrum was right in the middle. And basically it helps to elevate your sacrum off of the table, because your sacrum, which is your tailbone, needs to actually extend a little bit while you are pushing out your baby, because it creates the most amount of space for that pelvic outlet. So if your sacrum is completely flat against the bed, then it's going to run out of space to open, and so there's just going to be less potential space in your pelvic outlet to be able to birth your baby. So that was the third thing I did, was I didn't push flat on my back, didn't do that classic lithotomy position, and I used a towel roll. And then the fourth thing that I did is this wasn't something that I did, but it was something that I talked with my provider ahead of time. So I use midwives, hospital-based midwives. I don't know if people know that there are certified nurse midwives who can deliver in hospitals. I had her perform perineal massage between pushes, and she used a lot of oil as well. And there is a lot of good evidence to show that provider performed perineal massage between pushes can be really helpful in reducing tearing. Some also think that maybe it helps to occupy their hands so they're not as likely to perform an episiotomy. I didn't have that concern with my midwife about performing an episiotomy, but There definitely are some providers out there who are still routinely performing episiotomies, even though the research does not support them whatsoever. And then the last thing that I did, number 5, I think that's number 5, is I did not hold my breath while pushing. So the common way that they will teach you how to push during labor is, okay, you're gonna take a big inhale, then hold your breath, count to 10, and push as hard as you can. That's called closed glottis breathing. You're closing off your glottis. And it can generate, while it can be effective and is effective, it can generate a lot of pelvic floor tension. And you can try this at home right now. Try and hold your breath, and you immediately tense up your abs. You'll feel your pelvic floor kind of squeeze and gently lift up and in. And this can be really hard on your pelvic floor because you're generating tension, and now you're almost, that baby's head is pushing against a brick wall, that tense pelvic floor. So what I did instead is I did that big inhale, expanded my lungs, and then held that big belly. I usually say, like, take a big inhale, make your belly big and hard. You're going to keep it big and hard, and then you're going to exhale as you bear down and push, almost as if you're like trying to have a bowel movement, but do not hold your breath. So you're going to keep your belly big and hard, and then you're going to push down, bear down. Now, this is a lot more effective, not necessarily effective, but more gentle on your pelvic floor. Both methods are effective at getting your baby out, but one, the open glottis, can be more gentle on your pelvic floor. Now, the reason they don't really teach this in the labor and delivery room is, one, some providers just aren't super educated on it, and number 2 is it can be really tricky to kind of master the mechanics of it while you are in an intense situation like labor and delivery. And so a lot of women have a hard time with it. So I recommend practicing it before you get to labor and delivery, and ideally with a pelvic floor therapist watching you, so they can see that when you are bearing down, you're actually getting an effective push downwards. Okay, so those are the 5 things I did to help completely avoid perineal tearing with my first vaginal delivery with an epidural in a hospital. I hope this helps, and I'm going to keep giving more tips and tricks throughout my entire pregnancy journey. By the way, I'm 10 weeks pregnant right now with baby number 3.